Good morning, everybody. Good morning, and again, happy Friday. And it is that time of year where many head out of town for warmer climes. Unfortunately, an overabundance of sun exposure has led to melanoma for some. But there is promising news. A new therapeutic treatment option is now available that may help prevent melanoma from coming back after surgery. Dr. Jeffrey Weber with the Laura and Isaac Perlmutter Cancer Center in New York joins us, along with Louise Perkins with the Melanoma Research Alliance. Good morning, folks. Nice to have you here, especially to report on promising news. Doctor, maybe we can start with what is melanoma and who does it affect?
Melanoma is a cancer of the pigment cells or melanocytes that exist in our skin that mostly occur at the junction between the inner and the outer skin, otherwise known as the dermis and the epidermis. And when those cells become transformed or abnormal, they start invading. They can spread within the skin, but then can still be removed by the surgeon and the patient can still be cured. But if they spread further than that into the lymph nodes or other organs, the surgeon may still be able to remove them, but they're at a very high risk of return of the tumor, and if that happens, they may well die of metastatic melanoma. And those are the patients that we've been most recently dealing with in clinical trials to prevent the return of the tumor. The biggest risk factors for melanoma, well, it's folks who have pale complexions, who tend to burn and not tan, who have lots of funny-looking moles and freckles, who have red hair and blonde hair, who have blue eyes and green eyes, and live in a southern climate, or get intermittent sun exposure, as you point out, by going from the northern part of the U.S. intermittently to the southern part and getting a lot of sun and getting a sunburn.
Doctor, tell us about this promising technology using immuno-oncology and how this treatment might help people.
So before we talk about immuno-oncology, just by way of disclosure, I should point out that my institution gets research funds from Bristol-Myers Squibb and other companies to do the trials we'll talk about, and I also have taken funds to consult for both Bristol-Myers Squibb and other companies. But that being said, immuno-oncology is the field of study and treatment of patients using manipulations of the immune system, that is, drugs that alter the immune system to try to eliminate and kill tumor cells. Those drugs don't directly kill the tumor cells. They sort of educate and convince the immune system to do the job of eliminating the cancer cells, which is what they should have done in the first place. Because in the cancer-bearing state, our immune systems don't work normally. The term we use is the immune cells are exhausted by the tumor, and we reinvigorate the immune system using these new drugs, which have only been developed since 2001.
Amazing. I want to get over to Louise. Louise, obviously, I'm hoping that your alliance lets people know about these breakthroughs and can get the word out for people to ask their doctors about this new treatment.
That's definitely the case, Linda. The Melanoma Research Alliance is the largest nonprofit funder of melanoma research. We also provide patient educational resources for folks. I should also point out that we're very grateful to Bristol-Myers Squibb for their support of both our research and our patient educational mission. And the kinds of resources run the gamut of understanding what melanoma is, what are the new treatment options, what kinds of things you should discuss with your doctor, and a number of other things for patients.
It's great to get good news from this, right from you and of course, the doctor. Maybe you can tell us how our viewers can get more information.
There's a number of pieces of information that you can find from our website at curemelanoma.org. I would direct patients or their caregivers to our patient resources section if they're looking for information about a variety of questions. And there are also treatment options areas on our website that talk about the specific treatments, including this latest indication for nivolumab in the adjuvant setting for melanoma.
Well, I want to thank both of you for joining us this morning. You've imparted a lot of great information that I'm sure our viewers are very interested in. So thank you very much. And once again, don't forget, everybody, you can go to that information through the website, and you can talk with your family, and you can get a lot of support through that Melanoma Research Alliance. Okay, thank you to Dr. Weber and to Louise Perkins.